Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. Joining me at the noon hour is Dr. Michael Fine, former health director for the state of Rhode Island. A little programming note: after this broadcast, we'll have the governor at about 1 o'clock. She's always a little bit late, so call it 1:10 on the best side. Dr. Fine, Rhode Island's up over 400 cases. It doubled in 3 days. It had been doubling in 4 days. We're still behind in testing, only about 300 tests yesterday. In comparison, I think Mass was around 4,000, significantly higher even considering per capita. What does the number show to us today?
Well, around the country, we now have over 800,000 cases, an increase of about 66,000. We saw a little jump yesterday, as we often do the day after a weekend. It's hard to know what one day over the other numbers actually mean. In the United States, we have about 165,000 cases, a jump of about 20,000. Remember, again, that cases are just a measure of testing plus disease. Right. And I'm not sure I know what they mean by themselves. We have world deaths are now approaching 40,000. And the United States deaths went above 3,000 to about 30, almost 3,200. Most unfortunately, 4 deaths in Rhode Island, 408 total cases, 114 new cases, and 41 hospitalizations. We don't know how many people are in intensive care units. So the numbers are doing what we'd expect they do. The numbers are going up. We don't have a great measure of how fast they're really going up, because what we know is just a function of testing. And again, I'll say this over and over again, as far as I'm concerned, testing doesn't have much meaning unless we have something we can do with people who are tested positive, which means getting them into true isolation.
Let's dig into the numbers for a second. Number of deaths in the United States jumped by 50% in one day.
The number of new deaths, not the number of total deaths, I don't believe.
In the United States, jumped 1,000, I believe, in just 48 hours, excuse me.
Yeah, I think that's about right. But again, some of that is reporting. My guess is, but these numbers are going to go up. People are projecting 100 or 200,000. Until we have a better handle on community incidents, I don't think we're going to be able to make coherent projections. There are going to be too many deaths. This is a heartbreak, and happens. It's going to be 3, 4, 5, 8 times the number of yearly flu deaths we have, and those numbers are way too high. We get something like 25,000 to 60,000 deaths a year from influenza. We're going to multiply that by 4 to 10 times.
The other number that leaps out is of reported cases, of course, and the number is obviously higher. The mortality rate is staying at a lower number in comparison to a place like Italy. Their mortality rate is 11%.
I have to think that that's a function of their ICU capacity. Basically, you can really control the death rate if you have adequate ventilators, and if you don't, the death rate doubles. That's always the challenge. But again, we just are flying blind. Even in Italy, what we know is the number of tested cases, not the number of real cases. Right. So we have no clue about the real death rate or case fatality rate yet. We'll know it in 2 years, but we don't know it now.
The CDC, the New York Times has this morning that the CDC will be reporting their modeling. There's obviously best case scenarios and worst case scenarios. I think Dr. Fauci's been talking about this for a number of weeks. The president kind of pivoted and is now talking about actually the raw numbers. These modeling scenarios may be even significantly higher and much more disturbing. In Rhode Island, the Department of Health has consistently refused requests by GoLocal to release those modeling that they've done in this state. it's important that people understand what the implications of this is. Your thoughts on turning over the data to the public, both at the national level and the state level?
Well, I think modeling is really there to predict workforce need, at the workforce and resource need. I think we have been pretty effective at communicating, we got a problem, we got a disease, and we got to do something about it. And to me, that's the most important message that the public needs to hear. The specific modeling, like I said, is really for planning purposes. And I just hope that that modeling is being used to drive construction facility building and workforce. I've been saying this for a couple of weeks now, that in China, when they contained it in Wuhan, they contained it by bringing in 42,000 healthcare workers. The governor of New York called for 1 million healthcare workers. I'm not sure where they're going to come from, but when our surge comes, we're going to need healthcare workers either who aren't here, or we're going to need to repurpose people who are working. And from my perspective, we got to get going on that and use projections to drive how many we need, how to train them, because we're going to have to train a lot of people really quickly to do things that are out of their traditional scope. And that, it'd be lovely to get people who haven't worked in an ICU in years getting some experience working in the ICU now, so when we need them, they're trained and ready to go. That's what those projections, that's where they're important. I mean, the rest of it is, we got a problem, and as far as I'm concerned, follow the rules. That is, stay home, avoid other people. If you get sick, put a mask on and go into an isolation room of your own, and don't come out for 7 days. Those are the messages that we need people to hear and remember, and understand that the more we do that, the lower the deaths are going to be inside those models, which have different assumptions for disease penetrance. And we can drive disease penetrance, the number of people who get the disease, we can drive it down in the short term if everybody does what we're asking them to do.
Doctor, the implications of the coronavirus healthcare crisis is also having implications to other people who need significant public health treatments. They need cancer treatments, they need other treatments. What's the implication of this ongoing virus to other people who would be at a hospital getting radiation treatment or other things? How's that going to impact Rhode Islanders' health?
Well, we don't know yet. I am hoping that my colleagues around the state who take care of people with severe chronic diseases are continuing to do that using new technology where they can. Obviously, you can't do chemotherapy over the phone. And I don't know the extent to which that's continuing, but I'm hoping it's continuing as much as possible. We'll know, this is one of those things that we will learn 2 years down the line about what happened from care deferred or care that didn't happen. And that's, that's where the challenge for healthcare in general is to continue to do what we do with the people we do it. And at the same time, prepare for and address coronavirus wherever and however we can. Hopefully people are, and I think this is happening widely, people have learned to use new technologies, telephonic care or telehealth, or having appointments over computers. People are learning to do that. I'm just hoping we will learn that it worked.
We've got a video up of Central Falls, I believe it's Central Falls Police driving the streets over the loudspeaker that you had suggested, I think, about a week ago, asking people to stay in their homes and to follow the guidance of the executive order of the governor. Are you hopeful that this will help?
Yeah, in Central Falls, we're doing a couple of things. We're doing that. We're doing a big social media campaign. We've actually begun a community organizing effort to try to help people in their communities connect to and help with this. because it turns out, looking backward, that we stopped Ebola in Africa, not with doctors, but actually through community organizing, something Partners in Health put together, and it was brilliant. I didn't think it was going to work, but we're trying to duplicate some of that in Central Falls, and again, we will see over time if it works. I think Central Falls, Pawtucket, Providence, parts of Cranston, Woonsocket are particularly vulnerable because the way people live together, densely packed. That makes in-house transmission much more likely, and it's in-house transmission that really drove a good part of the epidemic in China. That's what we're trying to interrupt.
Doctor, lastly, when do we see the surge in Rhode Island based on the numbers you've seen? Do we know when is it? Is it the third week, the fourth week in April? Or does this kick over into May based on the modeling off the trends you see?
I need a couple more days of numbers to give an answer to that. You know, what I'm really looking closely at are the ICU numbers. I didn't see ICU numbers from yesterday. It's those numbers that tell me when we're, kind of at flood stage. So, give me a day or two, and I'll be able to answer that question with, I think, a little more sophistication than I can answer it today.
Dr. Michael Fine, thank you as always. For you viewers, 1 p.m. we'll have Governor Gina Raimondo with her press briefing, and at 2:30 this afternoon, we'll have Jennifer Lawless from the University of Virginia, one of the top political scientists in the country, talking about the implications of what the crisis has had on the political system, both from a standpoint of the presidential race as well as impacting Congress and the nation. Thanks everybody for tuning in. 1 o'clock, Governor Raimondo, 2:30, Jennifer Lawless. Thanks everyone.
Thanks, Josh.